All right, so welcome everyone to this Thirsty Thursdays. We are focusing on today psychosocial integrity, mental health. And I just want to let you know that I appreciate you when you show up. I appreciate you so much that I am shouting out those of you who are here right now in this space. If you are here from cohort 42925, I want you to drop in the chat 42925. I'm here and representing. If you are here from representing from cohort March 10th, 2025, I want you to drop it in the chat and say, I'm here representing for 31025 cohort. And if you are here representing from my February 11th cohort, I want you to drop in the chat that I'm here representing my 211 2025 cohort. And if you are here joining me from the December, yes, December 2024 cohort that kicked off on December 23rd, please drop in the chat. I'm eager to see who is in the house representing from either cohort. When you say you're here, let me know too that you're which cohort you're representing, so I know who came to see me here today, who was able to join me. Awesome. Yes, Edna, I see you from 211 representing. Whoop whoop. I see you, Johan, as well. Marie, welcome, darling. See you here from the April 29th cohort that's coming up. I can't wait to get started, and I'm so glad you're here in the house. Awesome. Yes, Gerna, welcome. Darling, welcome. My 429 peeps representing. Linda, I see you. Whoop, whoop. Sedane, I see you. Hey, hey, and hey. Yes. Welcome, welcome, welcome. Kim, I see you. I see you're here. Yulia, I see you. I'm so appreciative of you all being here today. I'm very excited, as you can see, to get this going. I'm so happy. So once again, welcome. Thank you again for joining. And if this is your first time, I've got a few rules of engagement. So how do we play? We're going to play, if you would, by doing some Q&A today. And each player, you all are my players today, my nurse players, you're going to be given approximately a minute, 30 seconds to answer each and every question. This is within the guidelines that NCLEX says they want you answering your questions between 1 to 2 minutes, right? So we're going to use the sweet spot of a minute and 30 seconds given for every question. Once you've determined your answer, I want you to drop your answer in the chat box using letters, not numbers. Please follow that directive because it helps me to tally up your answers. All right. So please use letters for your answers and don't second guess yourself. All right. We want to go with our guts. And more importantly, I want us to have some fun. All right. Have fun is very important for us here in this space, especially since it's our lunch hour. All right, so a couple of strategies. Once again, we're focusing on the psychosocial integrity focus this week with mental health being very much a part of this section. And so when we are doing these questions, I kicked this off in my when I believe Tuesday's class. We were focusing on psychosocial integrity. So I figured let's continue our efforts. But really, your answers should focus the response of the nurse with a response that is showing support, right, for the patient. The actions and the responses should be that of supporting that client in that question, being empathetic and showing compassion and understanding. That's really the biggest angle and strategy that you can come from with these questions. Using therapeutic communication, using those open-ended questions. I'm using the therapeutic approach of restating and clarifying so that the nurse ensures that he or she understands what's going on. Again, this is the strategies, and I call it the rosy response. So we're looking for an answer choice that kind of has like a rosy feeling, like a very nice response. And although it might not sound like something you would say to a patient, we have to think like NCLEX, right? We have to think about what they are looking for us in terms of how we respond. Okay. So looking for some of those rosy responses, especially if the patient in the question is dealing with something stressful, right? The loss of a loved one, the loss of an extremity, the loss of freedom. They are dealing with the loss of a job, depression. If they're dealing with some level of stressful times, um, we more than likely we're going to come back with a more therapeutic response that's going to convey a lot of these 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 angles of support, empathy, and compassion. But the other side of this is that you're going to see questions where the behavior in that question, right? So the client's behavior, right, is inappropriate. They are possibly trying to manipulate the nurse, the staff, right? Play one staff member against another staff member, right? Maybe they are, maybe their behavior is disrupting the group, right? Guess what? NCLEX is looking for you to be able to set limits on that inappropriate behavior. And remember, setting limits is all about letting the patient or client know what the expectations are, right? What the consequences will be if the behavior continues. That's where we start, okay? And then sometimes we actually have to carry out those consequences, right? So remember, setting limits, using therapeutic communication, and showing support and empathy, compassion, care, looking for that rosy, rosy response in the question. That's how we're going to get past this section, right? And answer more questions right than wrong. All right. So with that said, that's our strategy. So let's get to the questions. All right. So once again, our first question is going to take us, after I read the question, the timer will start. All right. So this question says a nurse is caring for a client who recently was diagnosed with terminal cancer, who says, I feel like my life is over. What is the most therapeutic? Okay. When you see that word, passion, supportive, caring answer that we can provide for this patient in this moment? I want you to drop that answer in the chat. All right, your timer's coming up. All right, I'm going to put a minute on the clock at this time. All right, what would be the most therapeutic response by the nurse? If it's over, cancers are stressful. A stressful diagnosis, especially being terminal. So, how can the nurse respond coming from that empathetic, understanding, caring approach to this patient? All right, about 30 seconds here on this clock here, and answers are dropping in. I see you. Let's go. All right, the time is clicking. It's counting down. All right, and I am on the screen. All right, time is up. So if you answered, let me just make sure I can close my timer. I got a whole bunch of stuff open, y'all, on my side. All right, timer has stopped. All right, so if you chose, I see answers coming in between C's and D's. Nobody really pointing towards A or B. So C and D, I feel like my life is over. Okay, so C says you're feeling overwhelmed. Would you like to talk more about it? Mm. This gets the patient talking and expressing their feelings versus this must be very hard. I like that. But it says, have you considered a support group? Mm, I like the support group, but the support group that's a future, right? Intervention. Having them talk right now gets the feelings out right now. So the more therapeutic response would be C, right? You're feeling overwhelmed. Would you like to talk about it? right now, right? Option C reflects therapeutic communication by acknowledging the feelings, the client's feelings, and encouraging them to further express themselves. Option D is helpful, but it is less effective than first validating and then exploring the client's emotions by having them talk right now. Okay, so option C it is. All right, let's go. Question number two. Question number two says a client in the emergency department says, I've lost everything. I don't want to live anymore. What is the nurse's priority? What is the nurse's priority? What is the nurse's priority? I hope the safety comes to your mind. The safety word. Don't want to live anymore. I've lost everything. What's our priority? All right, answers are coming in. Answers are coming in. Once again, what would be the priority? Quote unquote, I've lost everything. I don't want to live anymore. All right, our time is up. All right, so if you were pulling towards, and it looks like I see C's majority, then you were absolutely correct. At this point, this client is letting us know in a roundabout way, but kind of in a direct way. He says, I don't want to live anymore. So that's expressions of suicidal ideation, which is a medical emergency. Okay. Remember the word idea, right? Suicidal ideas. He's got these ideas and thoughts, but he says, I don't want to live anymore. So we have to stay with that client, right? Because he could harm himself. And this is where we would be performing a risk assessment to ensure their safety. The other options are appropriate after we ensure immediate safety and stabilize this patient. Okay, so even in this section, it's still about safety too. I probably should have put that on there too in the strategy, on the strategy slide. All right, all right, very good, very good. Let's keep it going. Let's keep it going. Next question says a client is admitted to the medical unit for alcohol withdrawal. 12 hours after admission, the nurse observes that the client is diaphoretic, tremulous, meaning tremors, tachycardic with a heart rate of 118, they're hypertensive with a blood pressure of 160 over 94, disoriented to place and time, and they state there are bugs crawling on the wall. So we're asked, what is the nurse's priority intervention in this moment? What should this nurse do? The first thing this nurse should do, based on the patient's presentation here. All right, answers are coming in. I see you. I see you. All right, what should this priority intervention be with this patient who is experiencing alcohol withdrawal, as evidenced by the following symptoms we see, the following vital sign changes? What is our priority in this moment? What could fix the problem? Above. Problem, solution. Where's our solution? And where's our safest solution? Below. All right, time is up. All right, very good. So I've seen majority of the answers that came in. We're pulling towards option A. I'm sorry, option B. All right, so if you went with option B, that will definitely solve this problem, right? The prescribed lorazepam, also known as Ativan, is what we typically give to patients who are exhibiting alcohol withdrawal. This client is demonstrating signs of it, and it's in the severe form. They are demonstrating signs of severe alcohol withdrawal, possibly progressing to a condition known as delirium tremens. This condition is actually a life-threatening condition. So the priority would be for us to give the benzodiazepine rather, like your lorazepam, your and other medications that can help to reduce this patient's CNS, central nervous system hyperactivity, and prevent them from going into seizures. And then we certainly want to initiate seizure precautions as well. Options A and C, they did not address the patient's physiological crises. And while fluids may be helpful, they are not the most urgent action at this time. So once again, we have a problem. We need a solution that's going to solve it. Okay, so think of your benzodiazepines as your first line of medications given to patients that are going through alcohol withdrawal. All right, very good. Excellent job. Y'all are doing good. All right, question number 4. We've got a client with schizophrenia who tells the nurse the FBI has planted cameras in my room and they are watching me through the TV. The client is visibly anxious and frequently scanning the room. So, what would be the best nursing response for this patient presenting in this way? All right, just under 30 seconds to go. Would love for everyone to drop in their thoughts. What do you think the best response would be for this nurse to this patient? All right, so I see some B's mostly. I do see an A, C and A as well. So remember, when we have patients that are dealing with schizophrenia, a lot of times they do have an alteration in their perception, right? And a lot of times with schizophrenic patients, they will hear voices, so they'll have some hallucinations there, but they also may be delusional too. So the fact that he says the FBI has planted cameras in my room, they're watching me through the TV, he's anxious, he's scanning the room. This concept or thought is considered to be a delusion, right? It's a false fixed belief or thought. So in this case, remember a strategy for patients that are delusional, right? We want to tap into the feeling that that delusion is causing them. Not so much get into why do they think the FBI is watching them, right? Because then that will start to continue to have the patient dwell on the delusion, if you would, and so forth. And we don't want that. We want to focus on what the delusions is causing the patient to feel in that moment, right? So by reinforcing that by saying to the patient, that must be frightening, right? Be a frightening experience. If we thought somebody was watching us, right? Cameras planted, watching us, right? Through the TV, we might feel a bit anxious too, right? That might frighten me. They don't frighten me if I thought folks were watching me. So we want to tap into that feeling. The best response for this patient is to use the therapeutic communication technique by acknowledging the client's emotional experience right in that moment. Okay, that is something that we would do, and then what it does, it also reinforces it's tapping into the client's emotional experience without reinforcing the delusion. We want to go into what is real. What's real is your feelings in this moment. You're anxious, you're frightened. Let's talk about that. Let's talk about that. That's the only thing that's really real here. But we're not going to say that. We're going to talk and focus on the feeling. All right. So option B validates the feeling or fear, but does not agree with or confront the delusional content. Again, takeaway here is to tap into the feeling. Make that your response here. All right. And another strategy is that unfortunately, we don't want to negate or discount or argue with the patient about the delusion. Telling them that they're imagining it is actually potentially going to have the patient hold on to or cling to that delusion even more. All right. So being careful about how we respond to patients in this moment. But the number one thing you want to take is you do want to ask, especially if you want to ask, right, about potentially a delusion. You do, in a sense, but you also want to tap into the feeling that they are also feeling with that delusion, if that makes sense. All right. So all right, so let's keep going. Let's keep going. All right, so number five, we've got a client with panic disorder who is prescribed buspirone for long-term management. Which statement by the client indicates the need for further teaching? Buspirone, what would indicate the need for further teaching? All right, answers are coming in and are in. All right, further teaching noted or needed when the patient says the following. We're closing in. All right, so when the patient says that B, I'll take this if I feel a panic attack coming on to calm me down quickly. Buspirone is not a PRN or fast acting medication. It is actually used for long term anxiety control, and it takes about 1 to 2 weeks or longer to become effective. It cannot treat acute panic attacks, unlike benzodiazepines. All the other statements reflect accurate understanding of the drug's use and precautions, which means that the patient can take this medication with food if it upsets their stomach. Um, the statement of, I know this medication won't work right away, it may take a few weeks, is accurate as well. And I'll avoid drinking grapefruit juice while taking this medication is also accurate as well. All right, so those are accurate, but we've learned that C is not. All right, so again, um, yeah. All right, it's very good on that one. All right, question number 6. Ooh. All right, we've got a client with moderate stage Alzheimer's disease who is newly admitted to a long term care facility. During the night shift, the client is found wandering the hallway, trying to open exit doors and saying, I need to go home and make dinner for my children. What's the nurse's priority action here? Get me out of here. Need to go home. What do we do? All right, answers are coming in. What do we do? All right. Okay, so y'all gonna learn something today. Everybody chose A. Well, guess what? The answer is B. Yes, I know. But let's understand why, because it's actually a good rationale here. So in this case, the nurse would have redirected the client by offering them a snack and engaging in a familiar activity. And why? Clients with dementia benefit most from redirection using validation and distraction techniques rather than confrontation or reorientation, which can increase their anxiety or agitation. Offering a comforting, familiar activity like a snack or something related to their home routines helps to de escalate this behavior. Option A, which many of you chose, may seem therapeutic, right? Because we're reorienting them, but reorientation can sometimes cause distress in moderate to late dementia patients. Yes. So option C, I don't think anyone chose this, but it is also appropriate later, which was securing the personal alarm, applying a personal alarm and notifying the healthcare provider of the wandering patient. Again, that's appropriate later, but not the first step. And option D is less effective and may come across as punitive or confusing, right? That this was the nurse escorting them back to their room and explaining that it's unsafe to walk around all night. So again, less effective little more punitive, could be confusing to them. So takeaway here is distraction techniques, and something that can essentially bring comfort, you know, with distraction for something familiar, etc. So that's the why. um, yes, yes. I see you, Kim. All right. So there you go. That's good. This is a good takeaway. This is why we do the questions, right? This is exposure. Exposure to how these questions could present, which is why we do these sessions. All right. This question says a 45-year-old with major depressive disorder tells the nurse, listen, listen, Edna, I've made peace with everything, and that I won't be a burden to anyone much longer. The client appears calm and is giving away their personal belongings and asks to be discharged early. Which is the priority action in this case? What is the nurse's priority action in this situation? Think, think hard on this. Think hard on this. Priority intervention here. Priority intervention here. Right. Answers are coming in. Answers are coming in. All right. So this question is a little tricky.
Miss Angela, I'm sorry. I see my answers. It's like it's coming directly to you. Or is it coming to the class?
I do not see your answers coming into the chat.
Okay, it doesn't coming directly to you.
So if you just adjust your setting that says to everyone, you may be accidentally sending it to someone else in the room. There is an angel in the room, an angel who is participating. So you might be sending it to her, maybe thinking you send it to me. But if you just right above where you type your answer, it should say to everyone. You want to make sure that it says to everyone in the meeting, and then it'll come into the group directly, and then I'll be able to see your answers. Oh, okay. Angel says she doesn't have it. Okay. Chioma, I see you. I got you. You just dropped it in. Yep. Good deal. All right. So this is a tricky one because I see in the chat mixture, A's, C's, right? I see also B, right? I see a mixture here. But the key here is if this patient only said, I've made peace with everything, I won't be a burden any longer, that is where the nurse would want to be asking, right? Directly, are you thinking of hurting yourself? Because of the statement made, right? We need more context. But the thing that changes this, where we would not choose B, okay?
So I'm sorry, Maria is sending directly to me. Maria is also sending directly to me. I just want to let her know.
Okay, Maria. Okay, no problem. Maria, make sure you do the same. Put your make sure that when you send your answer, that right above it it says everyone, so that it comes to everyone. Yes, yes, good deal. Thank you, Chioma. All right. So the reason why this is changed is because the patient says, yes, I've made peace with everything. I won't be a burden. If that was just it, and then it asks us what will be the priority action. Yes, we want to ask the client directly. Are you having thoughts of hurting yourself, right? Are you thinking of hurting yourself? But the fact that the patient goes on, this question says the patient is now giving personal items away, right? They're also appearing calm, giving personal items away, want to be discharged early. That is now we've actually gone past asking, right? Quote unquote, assessing, right? Their thoughts. We actually have to implement and move to actually an action that's going to keep this patient safe, because those are signs, right, of giving personal items away, appearing calm. These are red flags to the nurse that says they're going to likely kill themselves. Like this is warning signs, very serious warning signs, which is why we have to notify the provider and initiate a one-to-one supervision for this patient. Again, very serious warning signs. Again, giving things away, talking about not being around much longer, and suddenly acting calm. Big, big red flags. Red flags for the nurse, right? So again, in this case, the nurse would need to act immediately. This is action now that the nurse takes to keep this client safe by watching them closely. One-to-one supervision, telling the provider right away. B, again, that's important too, but in this case, the signs are already clear, right? You don't wait to ask, you act in this case, right? Because we had more than just a statement made, quote unquote. We had actions now from the patient that follow. C is supportive, but not enough when someone is at high risk, right? And then D would delay urgent action, which could be dangerous. We do not want to delay, we want to act. All right. So that's this was a great question, because a lot of times, yes, we'll be quick to say, okay, yes, are you having harm? Are you having thoughts of hurting yourself? But now with actions that follow the statements, oh no, we gotta act. We gotta act. All right. Very good. All right. So that is your rationale. All right. Question number 8. We've got a client with bipolar disorder who is in a manic phase, who is disturbing other clients by loudly pacing the halls and entering others' rooms. What is the nurse's most appropriate intervention to take in this situation? Manic phase, disturbing others. Look at the behavior. Right? Remember we said inappropriate behavior. Loudly pacing the hallways and entering other patients' rooms. So, what are we going to do? What do we do about it? What's appropriate? How do we solve this problem? Problem, solution. Where's our solution? All right, answers have come in. Okay, problem, solution. Yes, yes, I see answers. What to do? All right, so all answers that came in says the best answer or best action here is to escort this client to a quiet activity room and offer a structured task. A structured, low stimulus environment. Low stimulus environment is essential for clients in manic states. It helps reduce overstimulation while allowing the client to redirect their energy. Okay. Option A could escalate the pacing, and option C is punitive. Option D may be necessary, but is not the first response unless safety was a concern. All right. So this is very, very, very good. All right. Very good. All right. Next question. Let's go. Good job. Question number 9. Client with schizophrenia says the voices are telling me to hurt the nurse. The voices are telling me hurt the nurse. What is the nurse's priority action? All right, with 30 seconds to go, what is the priority action here? All right. Option B is the dominating answer here. To ask the client what the voices are saying and notify the healthcare provider. This is actually the correct answer because what the patient is how the patient's presenting is with they're having what we call command hallucinations. Hurt the nurse, hurt, those are commands, like commanding them to do something. Those are considered a psychiatric emergency. And the priority from the nurse in that moment would be to ask, right? Assess the content of the hallucination, meaning what are they telling you to do by hurting the nurse? We need to get that information through because that determines risk and it allows them to keep it allows safety precautions to be put in place. Okay. Once safety is assessed, the provider then should be notified. The other options either minimize the client's experience or delay assessment of immediate danger. All right. So that what we saw him doing or exhibiting was command hallucination. All right, very good. Excellent job. Let's keep it going. All right, question number 10 says a client with borderline personality disorder tells the nurse, "You're the only nurse here who actually cares. Everyone else is mean and ignores me." Hmm. What is the best nursing response? You're the only nurse, Gurna, that actually cares. Everybody else that's on this call, these nurses, they don't care about me. They're mean. They ignore me. Hmm. What's the nurse's best response? All right, we're just under 30 seconds to go. right, answers are coming in. All right, very good. So, borderlines, how do you, how do I remember? One of their key personality traits is that they like to draw a line and split, right? Play them against the others, right? They like to split, and that's what's happening here. When you can understand the actual personality disorder or the condition, then you can understand some of the behaviors that they're presenting with. You're the only nurse. That's drawing a line between one nurse and then the rest of everyone else, right? So that's what they do. All right. And so the best response in this case by the nurse that is the most therapeutic is literally going to respond by, let's talk more about how you're feeling right now. Again, clients with borderline personality disorder often exhibit the splitting, right? Drawing the line, right? Viewing others as all good or all bad or and so forth. The nurse should use therapeutic communication and gently redirect the focus to processing the emotions, right? What are they feeling right now? Processing these emotions. Option A reinforces splitting, and option C and D are defensive or invalidating. All right, very good. Very good, very good. All right. Question number 11. The client with narcissistic personality disorder becomes angry when not praised for completing a hygiene task and yells, "This place is a joke. I should be teaching you people out there." What is the most appropriate response by the nurse? "This place is a joke. I should be teaching you people." How does this nurse respond? Once again, make sure that your setting is set to send your message out to everyone. Um, it appears that perhaps there are some that are still sending it directly to others. Okay. Marie, if you can check your setting to make sure you are sending it, that would be great. Sending it to the group, to everyone. All right, we're coming down the stretch. I see your answers trickling in. And with that said, keep them coming. What would be the most appropriate response by this nurse under 10 seconds to go? "I should be teaching you nurses how to do your job." Okay. All right. So we can't take it personal, right? We have to understand this type of personality disorder. And in this case, responding by saying, "I understand you're frustrated," right? We are tapping into the feelings, but then going on to say, "Let's talk about what's upsetting you," right? Clients with narcissistic traits are sensitive to criticism and they may react with rage or grandiosity. "I should be teaching you people." Okay. But the best approach in this case is to remain empathetic, right? Empathizing, right? Redirection is good, and that's going to help the patient explore the underlying feelings without reinforcing entitlement. All right. Options A, B, D are confrontational and they escalate the conflict even further. All right, I'm actually going to switch it up this time. And the next questions ahead, I'm going to actually slice our timer down to 1 minute. All right, so that'll give us a little less time, make it a little bit of a speed Q&A so we can get the remaining questions in during our time. All right, question number 12 says, a client with obsessive compulsive disorder spends hours checking and rechecking that their door is locked before leaving the house. And during the session, the client says, I know it doesn't make sense, but I can't stop myself. So, based on this statement, which treatment approach is most appropriate to include in the care plan? Most appropriate treatment approach for this patient. 1 minute is on the clock. What's most appropriate? Twenty seconds on the clock left. Most appropriate. I just can't stop myself. All right. All right. Answers are in. And if you chose, I see B's, I see C's, C's and B's. Distraction techniques like journaling, drawing during compulsive urges. B, cognitive behavioral therapy. Cognitive is the thinking, behavior is the action, right? So maybe this type of therapy focuses on the thinking and the actions, right? Maybe lessening the behaviors, the actions, right, based on the thoughts. So, this cognitive behavioral therapy with exposure and response prevention, I know it sounds a little wordy, but guess what? That is actually the correct answer. This type of therapy is very helpful. The client has insight, they know the behavior is irrational, but still feel very compelled to do it. The most effective treatment is this CBT with exposure and response prevention, which helps them to gradually face the anxiety without doing the compulsion, right? Checking those doors, locks, right? A is more appropriate for delusions or psychosis. C may help in the moment, right? The journaling, etc., but doesn't treat the underlying pattern, right? And D would be less effective, what is less effective for obsessive compulsive disorder, and it is not the first line. All right, so very good to that. I believe our next question is a repeat question. Yes, it's a repeat, so I'm going to skip through 13. This is our hearing voices to harm the nerves, asking for them to get clarity, which brings us down to our last two questions of the day. And this question says, a hospitalized veteran with PTSD, post traumatic stress disorder, suddenly drops to the floor and screams, they're shooting, they're shooting, they're shooting. Take cover, they're shooting. What is the nurse's best response? They're shooting, they're shooting. I'm sorry. What are we going to do about that? Right? What are we going to do? How will we respond? Where's your rosy answer here? Where's the rosy response? The most therapeutic. Thank you, Yulia. Thank you. She's like, you got good acting skills. All right. So in this case, the patient is dealing with or experiencing some trauma, some triggering, right? So the best thing we can do is sit near this client, speak softly, orient them to the present. They're having a flashback. Previous trauma that they've experienced is what's happening here. So the nurse has to meet the patient in a calm, right? Very grounding approach, right? To reorient this client. Do not touch them because it could worsen their fear response. They might reflex and hit you, right? Shouting escalates the situation, and leaving the room delays essential de-escalation attempts by the nurse. All right, final question of the day. Let's do it. All right, final question. All right, let's finish strong. All right, a 19-year-old client is admitted for severe anorexia nervosa. And on assessment, the nurse notes the weight is 74 pounds with a BMI of 14.1. Vital signs: heart rate is 39 beats per minute. Blood pressure is 82/50. Temperature 95.9. Dry skin with lanugo. Patient denies suicidal thoughts, but says, I don't want to gain weight. I feel disgusting. Patient refuses to eat meals and is requesting to exercise in her room. What is our nursing action that is a priority in this moment right now? What is our priority action in this moment right now? I don't want to gain weight. Look at me. I'm disgusting. I feel disgusting. I'm not eating. Just let me exercise. What's our priority action? All right, so we got some mixed answers here. A's, B's, I see A's, I see B's, I see D's. All right. A, initiated one-on-one supervision during all meals for 1 hour after eating. So A is going to address the eating, right? Refusing to eat, which is typically what a lot of patients with anorexia do. But we've got bigger problems here. We got heart rate problems, we got blood pressure problems, we've got actual physiologic, right? The physical versus the psychosocial stuff, right? We have a problem. So A is not going to be the best option for us. D, setting limits on the physical activity and redirecting focus on coping strategies. Yeah, that can come later, right? After we've addressed the vital sign stuff, the heart rate. This heart is beating too slow. The pressure's too low, right? The temper, everything's out of whack. And we tend to see that with patients with anorexia. So the patient C would not make sense because they did not, they're denying suicidal ideations. B makes the most sense because we've got an issue with the vital signs that is bigger and greater right now than the problem with not eating, etc. And the heart, we've got heart stuff. Heart rate is slow, blood pressure is low. So we need, oh, I like that. Heart rate is low and blood pressure is, no, hold on. The other way. Heart rate is slow and blood pressure is low, right? So guess what? We got to do something. We got to monitor their heart. So guess what? It's going to be the most appropriate in this case to notify the provider about those vitals and their heart status, right? While multiple interventions are appropriate, the priority right now is addressing them right now because they are critically unstable right now, critically. The bradycardia, the hypotension, and the hypothermia, which all may signal cardiac instability and potentially collapse of the cardiovascular system. They are in trouble right now. This is a life-threatening emergency. And once again, suicidal ideation is not really a priority right now. No evidence of immediate self-harm. There's no one-to-one supervision during meals and limiting activity, again, are appropriate behavioral strategies, but are not the type priority in the face of this acute physiological, the physical, right? decompensation. It's winding down, heart rate winding down, blood pressure winding down, temperature going down. She's decompensating. So B is our choice. All right, so that takes us to the end, and I'll ask if there are any questions, if anyone has any questions at all. Any questions at all regarding this this topic, or this any other questions? All right. I hope this was helpful. Hopefully, giving you once again exposure, right, to these categories. If you are in any of my cohorts, like new cohorts or cohorts, um, yes, if you are in any of them and we haven't gotten to psychosocial integrity, guess what? It's coming. So this is like a preview to psychosocial integrity. If you are in my current cohort or prior or past cohorts, and we've done psychosocial integrity, this is just giving you even more insight to what we've covered, connecting dots, and exposing you to even more. I want to always end on the fact that our goal this year for 2025 is to get past this NCLEX, and you, each and every one of you, will do it. Why? Because you are unstoppable and you will do it. You got what it takes. I want you to stay positive, stay focused. You got the strength. You got it. And I thank you so very much for giving me your time. I appreciate